So that is heartening, right? Various degrees of normalcy returning to all of our big cities. It's the same in many other tier 2 and tier 3 towns and cities as well. And we will, of course, cover those here on India Today. But I would be remiss if I didn't remind you that there is sobering news as well. Yes, great that things are returning to normal, but the total number of coronavirus cases in the country has just quietly crossed the 1 lakh mark. According to the Ministry of Health and Family Welfare, India has 1,01,139 COVID-19 cases as of this minute. It has taken 64 days to touch that 1 lakh mark from 100 COVID cases, taking a longer period than other countries like the US, Spain and Italy, which have been hit much harder by the pandemic. A total of 3,163 people have died in India so far. 134 new deaths and 4,970 new cases have been reported in the last 24 hours, one of the largest single-day spikes. And according to the Union Health Ministry, for every 1 lakh, there are 7.1 COVID cases in India as against 60 globally. India also has the 4th highest active cases in the world percentage-wise, followed by the US, Russia and Brazil. I want to get a quick word in from India Today's Milan Sharma, who's been tracking the COVID-19 pandemic in India from the front lines of this story. Milan, 100,000 cases and counting, large single-day spikes being registered now. Where are we in this fight? What is changing?
Shiv, I'd like to tell you what the government is currently working on, because we know the number of cases have been spiking every day and we've already crossed the 1 lakh mark. But the government has also tested more than 1 lakh samples in the last 24 hours. And they are also looking at the numbers and trying to contain the fatalities in the country. India happens to have the lowest fatality rate at this point of time, which is just 0.2. And China has about 0.3. While the world average is way higher than where we are right now. So that is the death management and the clinical management strategy is something that the government is currently working on. And as all state governments that are slowly opening up their doors and trying to learn to live with the pandemic, it's very important that the hospitals don't get overwhelmed, which is why tracing, testing and isolation is the strategy that currently the government is following.
Very, very interesting points raised there. Thanks very much, Milan. Normalcy returning to India's big cities, but cannot take our eye off the ball. Those numbers are still increasing. No time whatsoever for complacency. Thanks very much, Milan, for that.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.